Hi, I'm Monica, and I work on your member care team here at Blue Cross. In this video, we'll go section by section to help you read your claim summary and understand what all the fields mean to you. First, let's talk about what a claim summary is. When you get care from a doctor or other healthcare provider, they send us a bill called a claim. We'll process that claim in our system and pay the provider our share of the cost. Sometimes you'll owe a portion of the claim too, for things like your deductible or coinsurance. Your claim summary gives you all the details so you can see what the provider billed us, what we paid, and what your share of the cost is. You might hear other people call this an explanation of benefits or EOB. They mean the same thing. And we've included the words explanation of benefits in two places in case you need to document your healthcare expenses. Now, let's walk through the claim summary one section at a time, and we'll point out all the important details. At the top right, you'll see a section called Claim Details. This is where we'll put the details that help us quickly look up this claim if you ever need to call and ask us questions about it. Your provider might also have the claim number as part of their records, so it's good information to have handy when talking to them about any bills they send you. As you move to your claim summary near the top of the letter, we've pulled out a few of the most important details for you to see at a glance. You'll see where you got care. This is the provider who sent us a bill. You'll also see the date of that visit. This helps you identify the claim if you've had more than one visit recently. Then we show you any share of the cost that's your responsibility. You'll also see the total amount your provider billed, how much was discounted because you have Blue Cross insurance, and how much we paid, and if you have other insurance, how much they paid. Remember, the claim summary isn't a bill. The provider will send you a bill from their office for your share of the cost. At the bottom, we show you a snapshot of your account update as of the date we processed your claim. We want this information to help you see how close you are to meeting your yearly deductible and out-of-pocket limits, but there are a few things you should know as you're looking it over. First of all, it won't include any claims we've received since the day we processed this claim summary. Also, we process claims in the order we get them, not by the date you got care. This is important for you to know because it can get confusing if you're trying to figure out when you met your deductible based on the date of your visits. Some providers bill quicker than others, and trying to figure out how much of your deductible you've met can be tricky. To get the most up-to-date information, we suggest you log into your account on Blue Access to see your account balances. If you need us to walk you through it, we're happy to. Just give us a call. On the back, we'll get into the details of the care you got and show you a breakdown of all the costs. In the Service Provided and Provider Billed columns, you'll see the exact care and services your provider billed and how much they charged. Sometimes you'll see more than one charge for a single visit. Don't worry, that's normal. Your provider has a very detailed code they use to bill us for each service you get. If they do lab work or other tests, or if you get more complex care like surgery or a hospital stay, each service will be billed as a separate charge. The Blue Cross discount shows how much you saved by having Blue Cross insurance. The providers in our network agree to give discounted rates for our members. Then you'll see what we paid for each service on your claim. In the column that shows your share of the cost, you'll see how we calculate your share of the cost. Here you'll see how much of the cost was applied to your deductible, copay, and coinsurance, and also any cost that wasn't covered by your plan. All these amounts get added up to calculate your total share of the cost at the bottom. We'll give you the total so you know how much of the cost is your responsibility, but it's smart to wait for your provider to send you a bill before you pay anything, and make sure the amount they ask for is the same as what's on your claim summary. If the amounts don't match, give us a call. We can help you work through it. Sometimes your claim will have notes that tell you how or why a claim was paid a certain way. If the claim is fully paid, you might not pay much attention to the notes, but they're there for you anyway. If it looks like a service wasn't paid, check the notes to see why. And remember, if you ever have questions about claim details, notes, or your share of the cost, we're happy to help. Just give us a call. We're right here for you.